My name is Nancy Koshy. I'm from Brooklyn, New York. Was not born there. I was born in India. Came here when I was 4, raised in Brooklyn. Did all my schooling there. I was a teacher for the blind for several years in New York. Then for some reason I had my first child and decided to go back to medical school. And now I'm at Inspira, very different from New York, but I feel very fortunate and blessed to be here. I have the ability to improve the quality of life that a person has mentally and health-wise. The bright spot of that is year after year you see patients growing up. You also see family members growing up and their dynamics with each other. So I think that's the brightest spot, just watching people kind of blossom. Women's health, kids' health, definitely prevention of diabetes and blood pressure, obesity. Right now, I see a lot of patients for depression and anxiety, and obviously that affects their overall health. Other things that people come in, skin abnormalities, sometimes patients come in with fatigue, or they just feel off. The advantage of being a family physician is if you're seeing a patient year after year, you can kind of identify with them, you know, like, oh, doctor, I don't feel the way that I did a year before, I just feel off. Sometimes when it's a new patient, it's hard to kind of understand that. It's an advantage being a family physician, seeing these patients year after year. I was a teacher for the blind for several years, so my background as a special educator, once you're an educator, you're always an educator. So when patients come in, I don't just give a diagnosis, I try to teach patients about it. Pictures, you know, try to make it as patient-friendly as possible, because if a patient understands things, it's more giving them more power to change their mind and their lifestyle. It's important to build a connection. Just like any relationship, you need to have trust. So people are coming in with their most worrisome symptoms, the most vulnerable aspect of their life. So I think they need to trust you, to trust the decisions you make, the labs you order, the information that you give. It's important in compliance and them following through with what advice that you give them. So that trust aspect is there. I think that's the most important aspect of building a relationship. My philosophy is mental health is very well connected to physical health, and I stress that with each patient. Even if somebody comes in for blood pressure monitoring, it's not just about getting pills into your body. You need to parallel that with good diet, exercise, and healthy lifestyle. So I always emphasize that. We don't want to keep upping your pills. You know, our goal is to overall improve your body. So, you know, the good root of primary care, I love treating, I want to prevent. That's what we're here to do.